When you're treating patients, you'll have to address more than one component in general for a patient's symptoms. So if someone's got knee pain, it's unlikely that just joint mobilization is going to work. You might have to address some muscle imbalance or some muscle strength issues, or maybe some muscle tightness. You may have to look at the way that the joint is moving itself. Are the ligaments giving pain? Are they become lax and unstable? So you're going to have to address each of those components. When you do, it's important that you retest after your treatment before you go on to the next treatment. So if you squat a patient and they get half range, what you then need to do is perform your treatment, whichever component is that you're treating. Once you've done that, you retest them with the squat to see if what you have done has been effective. That way you can determine whether you continue on to repeat that treatment technique. Do you keep the treatment technique but slightly tweak it, maybe increase the amplitude of movement or the intensity of the grade, or increase the depth of the massage if you're doing some work on soft tissues? But you can then judge the effectiveness of your intervention by retesting. If you do some massage, some joint mobilizations and some exercises and get the patient up and get them to squat, their symptoms may have improved, may have got worse, you don't know, but you won't know which component of your intervention has given the benefits that they've got. So it's important that once you're addressing the joint component, do a retest, whether that's just a passive range of movement. But it has to be comparable from what you tested before you started your treatment. So you pick some sort of assessment, or you pick some sort of measure that you can reproduce, then you treat them, then you go and repeat that measure, and then you can be really confident in the effectiveness of your treatment. And remember, if you perform lots of different treatments to lots of different anatomical structures, you won't be able to pick out which was the most effective component to the patient's symptoms as well. So one at a time, when you're learning, gives you a chance to build your clinical reasoning, and then you can apply that when you're seeing patients of similar symptoms going forward in the future.